Are you talking now?
I'm on. Do I have to do anything over here? Okay. Good morning, everybody. This is Leslie Brown. I'm a nurse practitioner at Piedmont Wellness Center, and we are going to be talking about all things related to nutrition, lots of different topics and ideas here. So first of all, why don't we talk about this question of what is real food? That's a good question for everybody because I think with what's available to us, it's not quite so real anymore. So the first thing, real food is it's recognizable in its natural state. That means that chicken nuggets aren't quite as real as a chicken is. So closest to its origin is what's really important there. The least amount of packaging, processing, man-made is what we're trying to avoid. So we're looking for real food closest to its natural state and not likely to be genetically modified. So let's see here. Then the next question, what are the effects of processed foods and refined sugars? That's a good question. There are lots of negative effects to food that's been processed, packaged, and taken out of its natural state. And the first thing is the sugar issue. Refined sugar is sugar or sugars that have that lack fiber. So once they're eaten, they're absorbed very, very readily into the bloodstream, have a quick impact on blood sugar levels. They trigger a release of insulin, which then cascades into inflammation and actually a suppression of your white blood cells, and then a drop in blood sugars subsequently, and fatigue, and that sort of thing. So it has kind of an immediate effect for the negative. Sugar also plays a role in terms of cancer. All cancers feed on sugar. All inflammatory conditions are made worse by sugar, and that's sugar of all sorts, whether it's regular white sugar, brown sugar, honey, fructose, natural or otherwise. So that's the downside of sugar. When you're looking also at processed foods, then you're talking about chemicals, a whole slew of colors, dyes, additives, flavor enhancers, fillers, just essentially fibers and binders that don't have any nutritional purpose. And the biggest culprit is actually MSG. Monosodium glutamate is a flavor enhancer that stimulates the appetite, causes the body to store fat, can immediately affect weight gain. And I've seen that clinically one night out to Chinese food, or in fact, Chick-fil-A is loaded with MSG, and then people see the consequences the next day. So anything processed and loaded with sugar are the types of foods to avoid. The question of organic, looking at is organic food better than non-organic food? And the answer is really it depends. Organic has lots of definitions, different ways of that being interpreted by the state, by different states. So primarily organic is going to refer to your fruits and your vegetables and your grains. And ultimately you want to look for plants that are raised in their more natural way, less chemicals, less pesticides, avoiding those kinds of things that are harmful. And that applies to organic. When you're looking at animals, organic is a little bit of a misnomer. You are ideally want to look for pastured, grass-fed, grass-finished, free range, no antibiotics, no hormones. And if there is an animal fed any type of grain, the grain should be raised organically. That's going to be a much more ideal food for that animal. So yes, organic is better, and there are certain foods, and I believe they were on our ebook or on our articles on the blog showing which types of foods you should choose organically because they're more prone to being damaged by the chemicals if they're not organic. Also, I guess in general, looking at what constitutes a nutrient-rich diet. Nutrient-rich diets are basically, again, going back to real foods. Real foods that contain protein. Protein is essential. Foods that are fats, because fats are essential. But carbohydrates are not essential, and so they're not necessarily part of a nutrient-rich diet. One of the things I frequently tell my patients is when you think about your meals, think meats, greens, and fats. Meats are your proteins. That's meat of any sort, poultry, fish, eggs. Then your greens are your vegetables, which provide some enzymes, some minerals, some vitamins. And then your fats, because they are essential. And so that's the basic human diet that we thrive on. When you throw in things like grains, legumes, sugars, processed foods, they're nutrient poor. They're high calorie, empty calories, and not nutrient rich. So again, going back to basic real foods that you find closest in their form to nature. The big question, what drives weight gain? That's one that everybody has a concern about. And we'll start with things other than diet to begin with. First of all, sleep is a major problem when it comes to weight gain or weight loss. Anytime the body is deprived of restful sleep during typically the night hours, weight gain is going to be much more likely. Shift workers struggle with that, whether it's night shift, evening shift, and they're not getting proper sleep between the hours of, say, 10 at night and 6 in the morning, weight gain is going to be much more likely. Lack of sleep is just a state of physiologic stress, and the body can't lose weight, and it tends to go into sort of panic mode and hold on to body fat much more readily. Stress, in the same way that lack of sleep is stressful to the body, external stresses, whether it's work, family, dangers, accidents, that kind of thing, causes a release of the hormone cortisol, and cortisol raises blood sugar triggers insulin, and the body simply holds on to body fat and tends, in fact, to store more fat more readily. Medications. We never think of medications as being weight positive or weight negative, but most medications, regardless of their purpose, are weight positive. It includes all antidepressants, antipsychotic medications, and antibiotics. All have a weight positive effect. So several courses of antibiotics in a year can really affect weight gain. And then you're looking at things like antihistamines, over-the-counter Benadryl and Allegra. All of those types of medications are weight positive. Cardiac medications that regulate heart rhythm or that are used for blood pressure, again, cause weight gain. And they can also affect blood sugar, which has its own issue in terms of the risk for diabetes. Medications that are used specifically for diabetes, insulin in particular, causes fat storage. And medications that cause the pancreas to release insulin, again, have the same mechanism of the body storing fat and making it much more difficult to lose stored fat. Menopause as a transitional time of life also predisposes women to the inability to lose weight as easily and, in fact, to some weight gain by a couple of different mechanisms. Menopausal women typically become more carbohydrate sensitive, more insulin resistance. The hormone imbalance between estrogens, progesterone, and testosterone also affects how the body stores or releases body fat. Usually at high estrogen levels cause the body just to hold on to fat more readily. So there needs to be some balance there. In addition, thyroid dysfunction or thyroid imbalance is important to the efficiency of the metabolism overall, so thyroid should be addressed as well in that time of menopause in particular. And then lastly, of course, diet is a huge driver for weight gain. High carbohydrate, highly refined, highly processed, chemicalized food is always going to be a culprit when it comes to weight gain. Nutrient poor, empty calories, that sort of thing. And then behavior. There's some behaviors with diet that we fall into pretty easily. Skipping meals. You would think that skipping meals causes weight loss, but it tends to make the body think it's starving and it will hold on to everything because it's not feeling comfortable with what's going on. So skipping meals is not a good idea. Alcohol intake. Alcohol intake always puts on hold the body's ability to burn fat. It's burned preferentially because it's a toxin essentially, and so the body doesn't lose fat as easily, and it tends to store those carbohydrates as fat. And another thing that we don't think of as causing weight gain is artificial sweeteners. whether it's Splenda, NutraSweet, saccharin. Those types of artificial sweeteners are somewhat tricky for our brain. The brain doesn't exactly know how to interpret those. It senses that there's something sweet, and it can respond very much like you've just had sugar. And so it can, in effect, cause an insulin release and a fat storage following that. And in addition to that, artificial sweeteners are, because they're not recognized, can stimulate the appetite, make you hungrier, make you crave sweets, and so therefore the behavior of eating just kind of takes on a life of its own. So diet becomes very important, of course, when it comes to weight loss. Okay, let's talk about low fat. Is low fat healthier? For probably the past 40, 50 years, we've heard that low fat is healthy. And one of the biggest problems with that is that, first of all, fat is essential. It is an essential nutrient to the human body. So to go without fat is to go without something that we need. Fat is fuel. Fat is an excellent fuel source for the body in terms of energy production, and a much steadier source of energy than carbohydrates are. It also helps us to absorb fat-soluble vitamins like vitamin A, D, E, and K. Those are essential to our human body, and without fat, there's no mechanism to absorb and store them and utilize them. The other thing we forget is that much of our body tissues require fat. Our brain is about 60% cholesterol and fat. The myelin sheath around our nerves, spinal cord are all made up of cholesterol and various fats. And around our internal organs, there's a type of fat that's very protective. So fat is not something we want to avoid. It's something we want to choose well and be sure that we're including it. So it's the type of fat that's most important. And there are three basic types of fat. There's saturated, which comes primarily from animal sources, and also coconut oil. And then you have monounsaturated fats, which are basically olive oil, avocados, some nuts and seeds contain monounsaturated fats. And then you have what are called polyunsaturated fats. They're primarily found in vegetables, nuts and seeds, and then they're commonly found in extracted oils. So what are the best types? Well, if you think about it this way, the human body stores fat in a 50-50 ratio between saturated and monounsaturated. So the ideal fat combination is 50% butter, 50% olive oil. That's essentially the makeup of human fat in storage, and that's what the body prefers. When you're looking at the types of fats to avoid, primarily that's going to be the vegetable oils. Extracted vegetable oils, or oils that include canola, safflower, cottonseed, soy, grapeseed, several types of seed or extracted oils are much, much more unstable. They're unstable to light and to heat. They're damaged easily, become trans fats very readily, and they create quite a cascade of inflammatory chemicals within the body. So anybody dealing with inflammatory associated conditions like arthritis, heart disease, cancers, those sort of things are aggravated by excess intake of polyunsaturated fats. And a more specific category, omega-3 fats, omega-6 fats. These are both essential, so even omega-6, although they're inflammatory, are essential, but in very small amounts. And you get plenty of those through foods, vegetables, that type of thing, without having to add external oils. And omega-3 fats primarily come from fish, fatty fish, eggs, nuts and seeds will also contain some omega-3s, and those kind of work in an opposite way, are anti-inflammatory. So that's essentially the take on fat. You need it, you don't want to avoid it, and you need to choose well what type of fat you're going to be taking in. Okay, let's see here. Nutrition as the core to overall health. Let's talk about that. One of the things I frequently tell my patients is that you cannot out-medicate a bad diet, you can't out-supplement a bad diet, and you can't out-exercise a bad diet. Diet has to happen first because you cannot operate on poor fuel, basically. So you start with the basics, and that includes real food with what the body needs to operate basically the best. And then secondarily, you add certain supplements that we may not get in our diet adequately enough for various reasons. After that, you add exercise. Exercise in a healthy form that doesn't put too much stress on the body, that's not creating too much inflammation. And thirdly, medications only if they're necessary. Medications don't fix the underlying cause that diet can usually address. So that's the basic thing. You start with diet first. And what's the hardest thing to do? Diet. But it's the most important and has the least side effects, essentially. So that's what you want to start with. And the other thing to think, we always think of diet in terms of weight loss. A weight loss diet may cause weight loss, but it doesn't mean it's a healthy diet. But a good, balanced, healthy diet will always cause weight loss if that's needed by the body. So you want to interpret that a little bit differently. And then lastly, we'll talk about what we do here at Piedmont Wellness Center. We try to look at our patients very holistically, approaching numerous angles, so we're seeing all parts of that person. And so that includes 5 different things that we typically address. Nutrition being one of them for sure. Diet and supplements, we'll start there. And more specifically, we work to avoid things that are allergens for patients, that are triggers for them in terms of weight gain or changing their behavior, and then toxins and chemicals. The cleanest food that their body tolerates is what we're going to try to achieve. And then detoxification. Detoxification are the means that the body gets rid of chemicals, environmental toxins, heavy metals, things that we don't need, that are essentially poisonous to the body. And the body rids itself of these toxins through breathing, through our lungs, through our skin, through our kidneys, through our liver. And so by different means of treatment, whether that's through supplements, through diet, through various cleanses, through some IV therapy, we open up those pathways so that the body can eliminate those things that it doesn't need. Then we also, thirdly, look at hormone balance. Hormones change day to day for women in most cases. They change as we get older. There are certain stressors and illnesses that affect hormones. Surgical procedures affect our hormones. So we want to make sure hormones are in the best balance that they can be at any given time, whether we're looking at thyroid, estrogen, progesterone, testosterone, and that goes for both men and women. And we're trying to bring balance in those areas so that there's not an excess of anything that's not needed. Supporting the immune system is another dimension of how we care for our patients. Immune function is affected by so many things, and that includes sleep and stress, obviously illness, vitamin deficiencies, and so we're going to be looking at all those things to optimize immune function. Immune function is important not just in colds and viruses, but also in terms of cancer and degenerative type processes. So we want to optimize all those means of improving immune function so that the body is able to handle what it has to deal with. And then we're also looking at exercise. Many patients exercise way too much. They're working with trainers, they're doing 5 or 6 days a week, and yet they're not achieving what their goals are. Their energy is still poor, their weight isn't dropping, they're creating a lot of inflammation and joint pain and that sort of thing. So we're going to try to make a few changes and recommendations in that area and add exercise when it's appropriate and add it where it's going to be most beneficial. Basically the most bang for the buck, so to speak. So 2 to 3 days of resistance, interval training, and other days basically movement. Things like walking are going to be most beneficial. So that's sort of the 5 ways that we approach our patients and our care for patients in a very holistic way. If you feel like this information has been helpful or you have further questions, we will be glad to do a 10-minute consultation by phone to see if we can help you or if what we're offering may be something that you need. Let's see here. Taking any questions? Okay. If anybody who's listening has any questions, we can certainly entertain a few questions. Well, thank you so much for your time today, and please feel free to call our office at 632-9944, or you can contact us via email and certainly take a look at our website. Thank you very much.